Hey guys, in this video we're going to talk about blood clots, heart attacks, and strokes, okay? A lot of people want to avoid blood clots. They want to avoid getting a stroke. I'm sure you do as well. And in your mind, what do you think is the number one thing that you have to avoid? Go ahead and type it down below. I want to know what you think, okay? Before I tell you, is it a food? Is it a certain thing? What forms the clots? Go ahead, type it down right now. And as you're doing that, I'm going to continue on with this little presentation. Now, in your body, the body is constantly forming clots and dissolving clots all day long, okay? And a clot is called a thrombus. And what makes up a clot is 65% fibrin, that's protein, okay? 20% platelets, 10% red blood cells. And by the way, platelets, fibrin, and red blood cells are all protein. 1% white blood cell, okay, that's protein too, and only 4% cholesterol. So my question to you is, did you type down cholesterol as being the thing that causes the clot? Okay, I'll find out when I read the comments. But the point is that a very small fraction of a clot is really made up of cholesterol. So consuming cholesterol is not going to form clots. It's not going to lead to strokes or heart attacks, FYI. Okay, so now we're going to talk about something called PAI-1, okay? I'm not going to tell you the long chemical name. I just want to let you know this is a compound that blocks something that dissolves the clot, okay? So remember I said that the clot is constantly being dissolved and formed? Well, this is something that stops the dissolving of the clot. Okay, it's an enzyme inhibitor. It blocks the enzyme that dissolves the clot. Okay, so we want to keep this very, very low, because when it increases the risk of developing a thrombus or a clot. Make sense? Okay, so basically it's an enzyme inhibitor. So now the question is, what triggers this compound? If you can know that, you can avoid these foods or substances or hormones, and thereby lowering your risk for getting a stroke, right? Okay, or a heart attack. Well, these are the triggers right here. Glucose, yeah, sugar. Insulin, we've talked about that a million times. Cortisol, that's the stress hormone, will increase the risk of getting a clot. And estrogen, that's why women that take HRT, hormone replacement therapy, are more at risk for getting a stroke. Interesting. So if you commented down there that it was saturated fats or cholesterol, it's actually not, because saturated fats are not one of the triggers. Cholesterol is not the thing that triggers a clot, okay? Thanks for watching.
Now, is there any way to tell if you potentially could have a blood clot? In this video, I'm going to discuss the 7 different indicators that you possibly may have a blood clot. Now, just because you have any of these symptoms doesn't mean you have one, but it's just good to understand how to read your body and understand what these symptoms could be related to. Now, the symptoms are directly dependent on where the blood clots are. You can have blood clots in your lung, the heart, your leg, your brain, and your pelvis. These clots could be anywhere where there is a artery or a vein. All right, number 1, leg cramps or tightness, okay? You could have this like throbbing, crampy tightness in your lower leg coming from something called deep vein thrombosis. All right, number 2, shortness of breath because the clots are in your lung or in your heart. You just get out of breath very easily, especially if you're doing any distance or inclines. All right, number 3, a sudden increase or decrease in blood pressure. Number 4, an increase in pulse rate for no reason. It just doesn't come down. Number 5, swelling in the leg, the foot, or ankle, or your arm or your hand on one side, usually. All right, number 6, excessive sweating. And number 7, discolored skin. It could be red or pale. Now, there's other symptoms too, like fatigue, but these are the 7 most common symptoms. So if you're getting any persistency with these symptoms, it might be a good idea just to get it checked out. Now, I also want to add a couple really important nutrients to help naturally keep your blood on the thin side, but it's not actually thinning the blood, it's just preventing clots in general. Vitamin E, specifically tocotrienols, is a very good form of vitamin E that can actually prevent clots. Second thing to take on a regular basis would be garlic. Garlic naturally keeps the blood from clotting. Quercetin is a good remedy to keep the blood from clotting as well. Turmeric is another one that's very, very effective. Cayenne pepper, really good at preventing clots. But here's the thing that you really need to know. People that are diabetic have a much higher risk of getting clots simply because they have higher levels of sugar in their blood. So people that have insulin resistance, people that are pre-diabetic, people that are consuming a lot of sugar or doing a high-carb diet are at a much higher risk of getting clots. So if you're concerned about that, definitely get on the keto and intermittent fasting plan. So check it out. I put the link down below.
So there's this hidden source of heart attacks that rarely does anyone know about. And this is a book by Thomas Levy, MD. And so I'll put the link down below, but it was actually quite fascinating because I have personal experience with what I'm going to talk about. Let me first jump to the smoking gun, okay? I'm going to tell you what he states in his book. In 78% of 101 patients with myocardial infarctions, that's heart attacks, and occluded coronary arteries, they found DNA of pathogens typical for infections in root canal treated teeth. Now, this is pretty wild. I've talked about this briefly in another video, but the big question is, what are these pathogenic biofilm microorganisms doing in your heart? How do they get there, and what's the relationship to your teeth? Now, they also found these microbes also in the clots in certain stroke victims too. Just a quick story. I went to the dentist a while ago, and they were just doing a routine checkup, and he had this really cool, so I think it was called a 3D cone beam imaging system, where they basically can scan all the roots of the teeth and look deep inside for potential cavitations or like infections underneath the teeth. Now, I was also an x-ray tech before I was a chiropractor, so I was interested in to see what was going on. And so when I was looking at my teeth, I noticed there was this like huge dark little circle around one of my tooth roots. Of course, he looked at it and said, yeah, you have an infection going on in your tooth. Now, I had no symptoms whatsoever. So basically this infection, which is an abscess underneath a tooth, was eating away my bone. And so based on this book, it's the chronic long-term infection that can become a problem for people, not just for heart problems, but for arthritis and many other issues. And apparently it's quite common. If you look up the condition's name, it's called chronic apical periodontitis, that many times doesn't have any symptoms. So basically, as you're chewing and things, you're pushing this bacteria deeper into the lymphatic system in your jaw and throughout the body. And Dr. Levy points out some really interesting data. There's basically between 15 and 25 million people a year that get root canals, okay? And his theory is that the root canal is where the problem is, because when they do a root canal, they go in there, they take out some of the pulp, and they try to sterilize it, and then they seal it. The problem is they also at the same time take out a lot of the tubules. You have like 1 or 2 miles of these small little tubes. And so as you scrape away this, you take away the immune system as well. So here we have this potential for pathogens to create problems, because it's nearly impossible to get rid of all the pathogens when they do this procedure. And so there's a high incidence of people with dental abscesses and chronic inflammation of the root of the tooth or the gums, and people who have heart attacks, which is actually very, very interesting. And many times this is missed on routine dental x-rays. One way that some people might pick it up is through a blood test looking at the C-reactive protein, which is just like a biomarker of inflammation. This infection could be in the tooth, it could be in the gums, it could be deeper into the jaw, and it can even be in the tonsils. It's the chronic exposure to these pathogens that create the problem, especially if your immune system is not strong enough to counter it, because these pathogens are creating a lot of what's called oxidative stress. Okay, now oxidative stress is basically a situation where you have a lot of free radical damage, but we don't have enough antioxidant reserve to counter that situation. I mean, think about how dirty the mouth is. You have over 500 different strains of bacteria, viruses, and fungus growing in your mouth. And then you also have this byproduct of the microbe, which is toxins that can then create more immune reaction, more inflammation in different parts of your body. Apparently, one of the ways the body reacts to this situation is by developing clots. And so over time, when this becomes more chronic, a person's going to generally feel fatigue, chronic inflammation, jaw problems, and sensitivity of the teeth. In my situation, I did notice when he removed the tooth, I immediately noticed my inflammation in my upper back and neck just kind of disappeared. So that was fascinating. But if I didn't get that x-ray and see that cavitation, I never would have guessed that would be the cause. But basically, we're dealing with a leaky bacterial overload situation that kind of causes a compromise to your immune system. But let's just say, for example, someone has this infection, right? And they feel a little tired, but they don't really know if it's coming from this area or not. You feel like your immune system is compromised and you are wondering if you have this oxidative stress overload situation. What you could do is just take 1 or 2 grams of liposomal vitamin C. It's not the vitamin C complex to fulfill a vitamin C deficiency. We're primarily using it as an antioxidant to lower the oxidative stress. And what's unique about this specific type of vitamin C is that it's one of the only ones that can go intracellular. I'd recommend taking maybe 500 milligrams several times a day. And this is because vitamin C is water soluble, so we just want to keep it flowing through your body. And the last point about this type of vitamin C is that it won't create diarrhea when you're taking large amounts like other types of ascorbic acid. But that would at least change the ratio of this antioxidant to oxidative stress level to see if that might help you. And if it does, and you feel a little bit better and you feel like your symptoms might improve, then you can start to dive deeper into why you might have this problem. Is it related to diet? Is it related to not sleeping? Is it related to overexercising? Is it related to a potential tooth infection? But this is just a short overview of this topic. I would highly recommend getting this book. It's filled with a lot more data. It's actually quite fascinating. So I'll put the link down below. And also, if you haven't seen my other video on atherosclerosis and this biofilm mechanism, I put that video up right here. Check it out.